Hello. We have a patient today who complains of functional problems during exercise. Walking, running, doing exercise in the fitness. He senses that there is something wrong in his gait, in the way his muscles work together. So we are going to investigate him and try to fix some problems in the way I do it in my practice, in my daily practice in Belgium. So the first thing we do is we're going to test for muscle strength in the lower extremity. So we will start doing the hamstrings. You can push your foot towards your back and push and resist to my force, which is okay, no problem. On the right side, you can flex. And here, the power is completely off. He can flex his, he can use his hamstring, so he can flex it. Do it, no problem. But he cannot resist. Do it again. He cannot resist to an extra force. Normally, if you test a muscle, can you push your arm like this? If you push a muscle extra information, so extra impulse, it should be able to lock the joint. Okay, thank you. But in this case, the hamstring is not able, flex it again, to lock the knee joint in an extra force being given to the hamstring. Can you turn around on your back, please? So we remember that we have a weakness on the left hamstring. Now this table is a little bit too low for me, but we will try to manage. Can you push your leg out, please? And keep it. Okay. The left gluteus medius, okay. Right one. Right gluteus medius is weak. Okay. Push out, 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 out. He cannot keep it. Tensor fascia lata. So can you please push your leg outside and up? Keep it. That's okay. Outside and up. That's okay. Tensor fascia lata, left and right. Okay. What else can we test? Quadriceps. Can you pull your knee to the shoulder? Very strong, very solid. The other one. Push up. Very solid, very strong. So we have the right gluteus medius weak and the right hamstring weak. Right. Now the thing is, we can start working on the hamstring or on the gluteus medius. But I'm more interested in what is causing the weakness of this hamstring and the weakness of this gluteus medius. And it would be even more perfect that it would be the same cause, the same thing causing the weakness in the hamstring and the weakness in the gluteus medius. And we only have to do one thing. That's easy for me. So let's start with the hamstring. So you can turn back on your belly. First thing we do, because the hamstring is nearly closely connected to the function of your ilium, left and right, we're going to check if there is a relationship in between the position of the ilium and the strength of the hamstring. So how we do that, it's quite easy. We just alter the position of the pelvis. So in this case, I would try to posteriorize the right pelvis. So the right pelvis goes posterior. And anteriorize the other one. Okay. So now the right pelvis is tilted backwards and the left pelvis is tilted anteriorly. And let's see what is happening with the hamstring. Can you push again? And now it's better, but not quite as good as it is on the left side. this one is really locked. This one, can you push? It's better than it is, but still there is some joint play. So I'm going to fine tune it. Maybe this is too much. So now we have only the left ilium anteriorized. Can you push? No. So I keep these two. Yeah. And can you push? Alright. A little bit better, but not good enough. Another thing we can check is the innervation. So the hamstring being innervated low lumbar and sacral. So let's pick a lumbar one. So I just contact the lumbar 5, L5, and I rotate it to one side. Let's see what happens. And now it's completely locked. Okay? If I rotate it then to the other side, push. Now it's gone. Okay? Gone. Even with the pelvis. So let's check without the pelvis. And we just, now we are back to the starting position. So flex, which is no resistance at all. The L5 being pushed, in this case, to rotation left. Push. No. So we need a combination of the pelvis and the L5. So we're going to work on that. So, now we know that if the pelvis is rotated like this, it's a good influence on the hamstrings. But if we rotate left L5, the hamstring is strong. Now we're going to check if this position is also favorable for the gluteus medius, who was weak on the right side as well. So we can turn around. The funny thing is, wait, you can just keep those in the same direction. On the back. Because now you have the same correction, okay? This one goes anterior and this one goes posterior. So it would be nice if this right gluteus medius would be strengthened as well. And you push outside with your right leg. Oh, wait, that. Slip on your sock. Yeah, push out. And it is correct, which is very nice. Now I'm going to ask for him for, we had, what rotation did we have on the lumbar spine? Left rotation. Yeah. So I'm going to ask him to rotate the L5 to left. So you have to pull on the right side. With this hand, so you can here pull on L5. Like this. Okay. Keep that hand over there. Turn, push out. Yeah, good. We take away the pelvis and you take away the hand. Right. You push out. Push, push, push. And now it's completely gone. He can do his best. Come on, you're a big guy. Push out. Nada. Okay. So we are lucky, we have L5 and the pelvis to influence both hamstring and gluteus medius. Okay. We could treat the pelvis, or we could treat L5, or we're going to look for who is responsible for L5 and the pelvis to be rotated. Okay? So turn back. In a normal situation, if you just do your practice, and you don't have to explain, this goes very quickly. It's a very easy way of testing. So flex the knee. This is weak. So we need something who might be causing the pelvis to rotate backwards on the left side, because if you tilt it anteriorly, it helps the right hamstring. So his pelvis is rotated to the back, to posterior. So that might be that the other hamstring is pulling too much on the left pelvis, on the left ilium. What we're going to do is we're going to ask, what happens if he pushes the knee? Yeah, you can flex. This is weak. What happens if we take out afferent information from the other one over here and push in? And now he gets strong. Which means that fixing the pelvis would help him, but fixing the hamstring is certainly necessary. Okay? Even though his other hamstring is strong. Okay? But if we touch the hamstring itself, push, it's weak. So there is a problem in this hamstring, because if you irritate the hamstring, it gets weak. If you test it in a normal situation, flex again, it's strong. And whenever we start irritating it, it's gone. So I can switch it on or off if I want to. So what we're going to do, you can keep looking further, but we will cover that in the course, how to look further and further. Here I will treat this part of the hamstring, the left hamstring, and see what happens to the other hamstring and the gluteus medius on the other side. So for treatment, you can do whatever techniques you're used to do in your practice. So you can do a deep tissue massage, like on the hot spots, like a real scratching all the adhesions. It's okay for you? Is it? Yes? No. That's okay. Really deep until I feel the tissues, they melt away. And now it's gone. Okay, a little bit lower is another spot. Sometimes it takes 5 seconds, sometimes it takes up to 20 seconds. But after all, they all disappear. Okay? Let's see what happens. We don't have corrections in the pelvis anymore. Flex the right hamstring. Yeah, this is strong. Very nice. It would be nice if the gluteus medius would be fixed as well. So can you turn around again? Yeah. So we had also a weak right gluteus medius push out, which also is strong. This is very nice. Is this enough? Probably not. But this shows how it's worked, how I work with manual muscle testing to do a diagnosis, to know which thing is important to do to help a weak muscle or to help a problem. I will see him back in 1 month. So he's going to do his exercises again, and he's going to tell me, I hope he's going to tell me if there is a difference, yes or no. Okay? One thing I want to check is this L5. If the L5 is still present, I'm going to fix the L5 as well right away. So you can turn on your head. And how do we do that? We take a healthy muscle, so the right one was strong the right one was strong if you don't do any extra impulse. So can you push the left one? Okay. Now I'm going to look if there is a problem on this L5, if I push it right. Yep. Yeah, okay. direction. So can you go on your right hand side? Can you lay on your right hand side? Right? Yeah. Oh, sorry, left. That's why you were thinking. Now this table is very low. Can you come to the other table? Just for my comfort. So in my testing, I knew that if I rotate L5 in this direction, so to the right, it weakens its normal hamstring. If I rotate it to the left, it stays strong. So I need to rotate it to the left. Can you put that exactly what it is? Like this. Yeah. Don't have any problem with herniations or something like that? You can do whatever technique you are used to work with. Then you can go on your back again. Maybe you take that table again. Lay on your belly. We take once again this normatome muscle. You flex the knee. It is strong. It was weak when I pushed it to the right, so push again. And now it stays strong. So I finish. Because I fixed the L5 for the hamstring, I fixed the other hamstring for this hamstring, and what else did I do? That's all. So let's see what happens. Can you flex again? This is still strong. You can feel it. I hope you can feel it too. That is different than before. He says yes, there is difference. The big advantage in this way of working is that you, by testing, sometimes you need to do 1, 2, or 3 things to fix a lot. So there was a problem over here. Maybe this problem was due to the L5, could be. We leave the pelvis for what it is now, and next time we will see it further. Okay, thank you very much. You're done. You stopped filming? Stop filming now.